In this video, shared by Dr. Daniel Louzada from São Paulo, Brazil, we will discuss strategies to prevent bleeding in cases of proliferative diabetic retinopathy. This is a case of a patient with proliferative diabetic retinopathy and tractional retinal detachment with a nasal retinal tear near the optic disc. We can observe areas of fibrovascular proliferation connected to the optic nerve, with a vascularized pedicle in the inferior temporal arcade. Initially, the surgeon performs a core vitrectomy, isolating the traction areas from the posterior pole to the peripheral retina. Next, the vitreous base shaving is carried out. At this point, panretinal photocoagulation with endolaser is performed to ensure treatment of the attached retina before addressing the traction areas. This approach ensures treatment of the entire ischemic retina before addressing the fibrovascular tissues. After panretinal photocoagulation, the traction points are approached. We can use the endolaser in continuous mode to achieve adequate hemostasis of the bleeding points. Triamcinolone can be used both as a dye and as an adjunct for retinal hemostasis. Then, the vascularized pedicle in the inferior temporal arcade is grasped with a retinal forceps and cauterized with endocautery, preventing bleeding during the reduction of fibrovascular tissue. Segmentation of the nasal traction connecting the optic nerve to the retinal tear is then performed, with possible hemorrhage. A fluid air exchange is carried out, and the retinal tear is treated with endolaser. A good final aspect of the retina is observed, with no areas of preretinal hemorrhage. Finally, C3F8 gas is used as a tamponade.